Sir, this year's theme for CSI has been preventive cardiology, and I'm sure all the state units will also follow the same theme. Being the General Secretary for CSI of Telangana State, I would want to know what would be your message to our viewers about do's and don'ts to prevent heart attack?
Preventive cardiology aspect is a very, very important thing, and we have to educate the patients. Those are really high risk patients, what I call is a high risk patients. And first and foremost thing is the regular exercise. We are asking regularly to take 30 to 45 minutes per day, either a normal walking or a jogging. And number two, which I am seeing at Hyderabad Continental Hospital, there are lots of IT guys which are there. They are having so much of stress and strain. To relieve the stress and strain, we need so many things. And first and very important is this yoga, pranayama. This is really helpful. And number two, which I have already emphasized, that regular exercise is not only for the physically but for the mentally also it is useful. So first, exercise, stress and strain, reduce stress and strain, and you have to concentrate more on the diet. The diet what you are taking, you have to think once at least taking the diet, whether you are taking a right diet or not. And I pledge that you take more of salads, more of greeny vegetables, and if at all really you want a non-veg, you can take some fish and white portion of the egg. Egg is a really good proteinous food, and fish and egg is really. And I pledge to all this my high risk patients to take regularly leafy vegetable and more of salads.
Any other habits you would want to stress on?
These young guys nowadays, because of so many media and all these things, it has came down, but smoking is a very, very injurious, not only to the heart, the whole body has been affected by that. And we have seen that stress and strain and smoking is almost in young hypertensive, 20 to 25% is the main cause for the cardiovascular event. Either cardiovascular event like acute coronary syndrome, myocardial infarction, heart attack, and cerebral stroke. So smoking is a very, very important factor. And not only smoking, heavy alcohol is also it is not advisable. Previously we thought that minimum moderate, mild to moderate amount of alcohol is beneficial to the heart, but it is not the thing. In Western countries where the temperature is always less than 10 degree, and that may be helpful but in Indian subcontinent where the temperature is always more than 26 or 30, it may not be helpful. So I request to all the doctors and to my patients that to the doctors I advise not to promote any alcohol, moderate, mild, which is written in the Western books, and to the public that you should avoid as much as possible alcohol intake also, and quit or stop smoking at any cost. That is a very important thing. We have to take a message to the public.
Thank you very much, sir. I think though it might sound very simple, it's a very strong message that CSI is putting forward this year, and I hope all our viewers will be benefited by hearing.
Yeah, one more last thing I just want to know, there are so many views are coming in that if at all any patient is having chest pain, immediately consult to the physician. Whether it is a cardiac pain or a non-cardiac pain, hardly matter. Immediately get it done, one ECG, that is a life saving. Don't waste your time. Time is brain. That is very, very important. You have to go to any of the nearest physician and get it done. And better that if you participate in any of the lifestyle modification like regular exercise, that will almost reduce our heart attack chances by 33%.